24 days ago, I made a decision to document my rise publicly, not knowing who would watch, who would judge, or who would join me. Day 24, 6 days from the end of this 30-day journey. And today is not a teaching video. Today I want to be honest with you about what this journey has actually taught me about health, about wealth, about faith, about legacy, and most unexpectedly, about myself. What I got wrong in the first week. Let me start with something uncomfortable. When I began this journey, I thought the hardest part would be the content, finding topics, writing scripts, researching facts. I was wrong. The hardest part was something nobody warns you about. The exposure. Putting a belief into a video and watching it sit there publicly, unable to be edited quietly or walked back privately. That exposure does something to you that writing in private never does. I learned in the first week that documenting your rise is not the same as performing your rise. Performance hides the doubt. Documentation reveals it. And the videos where I allowed the doubt to show, where I admitted I have not been accepted to Harvard yet, where I admitted the financial architecture is still being built, where I admitted some days feel lonely. Those videos connected deeper than any polished performance ever could. What surprised me most about the health conversation, I expected the health content on this channel to be the most straightforward part. I am a doctor. Health is my training. I know this material. What surprised me was how much the health conversation kept circling back to wealth, faith, and family. Subjects I did not initially plan to discuss as deeply as I have. I could not talk about maternal mortality without talking about poverty. I could not talk about direct primary care without talking about the financial architecture required to sustain it. I could not talk about the family as the first healthcare system without talking about faith community as the original support structure. 24 days in, I am more convinced than ever that health, wealth, faith, and legacy were never meant to be separate conversations. The world treats them as different departments, different ministries, different conferences, different academic disciplines. But in the actual lived experience of every patient I have ever treated, these four things are completely entangled. You cannot architect health without also architecting wealth, faith, and family. This channel taught me that more deeply than my decade of clinical practice ever did. What I learned about building a public voice. 24 days of public content creation has taught me things about leadership and voice that I want to pass on directly. Consistency outperforms perfection. Some of my best performing videos were not my most polished ones. They were my most consistent ones. Posted on time, on schedule, without excuse. Vulnerability builds more authority than credentials alone. My medical degree gives me permission to speak about health. But my honesty about the Harvard gap, about the financial planning, about the loneliness of building, that is what made people actually listen. Your specific story is your competitive advantage. I spent years believing my cross-continental story, Ghana to Brazil, was a complication to explain rather than an asset to lead with. This channel taught me the opposite is true. Nobody else has this story. And the thing that makes you most different is the thing that makes you most necessary. Building publicly accelerates building privately. discipline required to post daily has made me more disciplined in my clinical practice, my financial planning, and my Harvard preparation than I was before this journey began. Documentation is not separate from the work. Documentation is now part of how the work gets done. What I still do not have figured out. I want to end this reflection with honesty, because that is the entire premise of this journey. I do not have a Harvard acceptance letter. I do not have the full financial architecture built. I do not have the DPC network operational yet in Africa. I do not have all the answers to the questions this channel raises every day. What I have is 6 more days in this 30-day commitment and a conviction that has only deepened with every single video that documenting the building process, messy, incomplete, uncertain, is more valuable to the people watching than waiting until everything is finished to show them a polished result. Because the young doctor in Lagos who is watching this, the nursing student in Sao Paulo who found this channel last week, the health entrepreneur in Nairobi who is building something similar, they do not need to see my finished institution. They need to see the building process, including the uncertainty, so they have permission to begin building their own institution before everything is figured out. That is what 24 days has taught me. The documentation was never really about me. It was always about giving someone else permission to start. If this honest reflection resonated with you, share it with someone who is building something and feeling the exposure of doing it publicly. 6 days left. Subscribe. Comment below. What is the most honest thing you have learned about yourself while building towards your goal?